Hello and welcome to another video version of Beauty by Buford. Today's topic focuses on Voluma and asks the question, is Voluma right for me? Voluma was recently approved by the FDA for use in soft tissue rejuvenation of the midface for the company Allergan, which also produces Botox as well as Juvederm. To answer the question that we posed, is Voluma right for me? We first have to look at how we use facial injectables and then also look at the individual properties of Voluma. So looking at the facial injectables currently available, what we focus on is the area that we're looking at rejuvenating. In other words, are we looking at the lips? Are we concentrating on the cheeks? Are we looking at the jawline, the temples, or simply fine lines, which tend to be very superficial? Knowing where we're going to be injecting, this helps us dictate or helps us choose which filler is going to be appropriate. As you can imagine, if we're injecting deep in the cheeks, we want a filler that has a good amount of lift, a thick consistency to it, and we probably also want a filler that's going to last a while. This is where Voluma comes in. Voluma is a very, very effective filler for treatment of loss of volume to the mid cheeks. It's also very effective for other areas that are similar to the cheeks, such as the jawline, the temples, and also an area that we often forget, and that's the hands. Voluma can be a very, very effective filler for use in restoring lost volume to the hands. So why is Voluma not a good filler for superficial lines or wrinkles? Well, the answer is because Voluma is has a very thick consistency. It is a filler that is more tailored to deep placement, whereas a filler such as Juvederm Ultra, which is the thinnest filler that Allergan produces, is a much better alternative to use in treating superficial lines and wrinkles, as well as areas such as the tear trough. That's the area under the eyes, which is very, very thin. So keeping that in mind, when you're talking to whoever is going to be doing your facial injections, ask them what products do they use, what their experience is, what their background training is, and what they would recommend for you. Keep in mind that, again, the filler tends to be chosen not only by the practitioner, the injector's experience, but more importantly by the location where the filler is going to be placed. So in reality, a combination of those two factors, the injector's experience with the various products, and number two, the area being injected, those are really two main determinants which allow us to choose which filler is going to be appropriate for you. I hope this information was helpful. I look forward to working with you. We should have Voluma very shortly within the next week. My office phone is 303-747-6719. I can also be reached by email through Dr. Buford, that's Dr. Buford, at beautybybuford.com. You can also visit us through our Facebook page as well too. We look forward to working with you. Be well, and let's keep you looking your very best. Have a great day.